Okay. Woohoo! All right, so we're going to go into an overview of ElderHelp. What is Alzheimer's and dementia and some of the risk factors associated with it, the progression and safety considerations to have with someone with dementia, and how to be a successful caregiver for someone with Alzheimer's or dementia. And then we'll go over a little bit about dementia in the holidays, because that is now coming up. We're a week away, and some tips for that. And then, of course, at the end, we will have some time for questions and answers. So ElderHelp, our mission here is to provide personalized services and information to help seniors remain independent and live with dignity in their own homes. Our services and programs are intended to reduce the social isolation and any resulting health and medical issues associated with that. So we help with things like transportation. We do a lot of companionship. We can go in and help seniors' home be safe. So if you ever have any needs that you think we can help you with either you or your loved one, please don't hesitate to reach out, of course. So what is Alzheimer's and dementia? I'm sure most of us on this webinar already know a little bit about Alzheimer's or dementia, but I'm going to go over the difference between the two and what makes them different. So dementia is an umbrella term that is used to describe the symptoms that can impair memory, communication, and carrying out daily activities. So in order to be diagnosed with dementia, you need to have two of the following functions need to be impaired. So your memory, of course, but not all people diagnosed with dementia can have issues with memory. It can start with things like cognition, so the decisions that you're making or following directions. Your behavior, maybe someone is kind of changing their behavior, they're becoming more aggressive or more agitated, a lot of signs of depression, or their physical functioning, so they don't have as much balance as they used to, or their fine motor skills aren't working as much as they used to. So dementia is not a specific disease. If someone is diagnosed with just dementia, that is an incomplete diagnosis. It's like saying that you are diagnosed with cancer. There's many different kinds of dementia. There can be Alzheimer's, there can be vascular dementia, mixed dementia, or dementia can be caused by something like Parkinson's. About 50% of cases will turn into Alzheimer's or be diagnosed as Alzheimer's, though. That is the most common type of dementia. So what is Alzheimer's? Alzheimer's is a slow, progressive disease of the brain that impairs memory, thinking, and behaviors. It is caused by the formation of proteins that are called plaques and tangles. And the symptoms or plaques and tangles can start to form in the brain 20 to 30 years before signs of Alzheimer's show up. So someone can have these in their brain well into their younger years, but we don't know that they have dementia for many, many years. Alzheimer's can only be officially diagnosed after an autopsy, but the diagnosis is correct about 90% of the time. So while the person is living, the diagnosis of Alzheimer's is most of the time correct. And Alzheimer's usually affects short-term memory more than long-term memory, and that's a big distinguishing factor. And when diagnosing someone with Alzheimer's, is their short-term memory is more affected than their long-term memory. And here in San Diego, about 65,000 people are living with Alzheimer's disease. So the facts about dementia and Alzheimer's: every 66 seconds, someone in America develops dementia, and 1 of 3 seniors die of some kind of form of dementia. Since 2000, deaths caused by heart disease have declined, yet dementia-related deaths have increased. It's not a normal part of aging to have dementia, and one of the biggest reasons of this huge increase in deaths related to dementia, yet the decrease by almost every other top 10 leading cause of death, is that dementia is the only cause of death without prevention, a cure, or that can be slowed. Right now it is the 6th leading cause of death here in San Diego. That number is a little bit higher. I believe it is the 5th leading cause of death. And this number of the leading cause of death is increasing because people are living longer. So the longer you live, the more likely you are to have a diagnosis of dementia or to develop a disease that can cause dementia. Normal aging versus warning signs of dementia. So like I said, dementia is not a normal part of aging. This list here are things that can be normal when you start to age, but I'll explain a little bit differently how dementia would make these things different. So missing a monthly payment. Everyone can miss a monthly payment. That's not a warning sign of dementia. It can happen to anyone. A warning sign of dementia would be missing multiple payments, or always paying the wrong bills, or forgetting completely about a water bill or a cell phone bill, just always having it be missed. Forgetting someone's name or a familiar word can be normal. We've all, had that experience. We're like, oh my gosh, what is that word that we're thinking of? What's that person's name? But with normal aging, you have other cues. You see someone's name tag, or they say something like that event that we were at last week, and you remember their name or how you remember that person. With dementia, you'll never remember that word. You'll never remember that person's name, even with cues on what that word or that person's name may be. Occasionally misplacing something. This is normal. We've all lost our keys, lost our glasses, but people with dementia will not be able to retrace their steps and find that thing. A really common place that people put things with dementia is the refrigerator or the freezer for some reason. So just a tip, if you are a caregiver, look in the fridge or the freezer, but they may be spending days looking for a certain item because they just can't retrace their steps and gain clues on where they put something. Not feeling like a social gathering. We've all been there Friday night. We're tired. We don't want to go to a social gathering. But someone with dementia won't want to. They'll start dropping out of all of their social activities, things that they used to go to weekly, friends that they used to see all the time, because maybe it's too overwhelming for them to have so much stimulus going on around them. And of course, we've all made a bad decision every once in a while, but people with dementia lose that reasoning of why they're making decisions, or going through the steps of, is this a good decision? Is this a bad decision? So you'll start to notice people with dementia start making a lot of bad decisions. So some common dementia symptoms, of course, the memory loss is the number one thing that we all think of when it comes to dementia. Like I said, it's usually more of a short-term memory loss than a long-term memory loss. Having problems with problem solving, following directions, so things like following a recipe, or driving. That's why driving becomes so difficult. Trouble finding words. As we age, it's normal to have tip of tongue experiences, it's called, but we'll never remember the word that we're looking for, or maybe we mix up a lot of words and not using them in the right context. Poor judgment, so making more bad decisions, changes in personality and behaviors. Depression is really common with people with dementia, but they're not themselves anymore. Maybe a really happy person their whole life is now becoming very agitated and easily disturbed. Difficulty with balance, coordination, and spatial awareness. A lot of falls, a lot of missing their steps. And then becoming lost in familiar places and losing common objects. So you're becoming lost in your neighborhood that you've lived in for many, many years, or in your daughter's house, places that you're at a lot of the time. So some of the risk factors for people with dementia. Age, of course, the longer you live, the more of your chance of getting dementia. No age, it's not like you make it to 85 and you're safe from getting dementia. About 1 in 3 people over the age of 85 will have some form of dementia. Female, for some reason, females are more likely to have dementia. About 2/3 of all dementia cases come from someone who is female. So our genetics aren't directly related to dementia. There has not been a direct find on that kind of relationship, but there are, of course, direct relationships of our genetics in things like heart disease and diabetes, and those are, if you have one of those diseases, you have a higher risk of getting dementia. The years of formal education that we have, but also just if we're continuing to educate ourselves throughout our life. And this is not necessarily we're going to get another master's degree or a PhD or another bachelor's degree. This is things like learning a new language. Of course, we've all heard that doing crossword puzzles and things like that, learning new card games, learning new board games, those are going to help us with learning new things. And traveling is also another thing that can help us. Head trauma, of course, we've all heard that head trauma, frequent falls, those are things that will cause dementia later on in life. And then Down syndrome. 95% of people with Down syndrome will develop dementia, but again, it's not known why that is. Ooh, what happened there? So to lower your risk of dementia, exercise, of course, that's increasing the blood flow to the brain. A healthy diet, for some reason a Mediterranean diet, has been proven to slow the progression of dementia or the onset of dementia, and so that's high in like healthy fats, low in sugar. Intellectual activity, so learning new languages, educating yourself, reading a lot, doing new games, activities. Our emotional health, and really with emotional health, this is keeping our stress level down and getting a good amount of sleep every night. And then, of course, not smoking. If you are a smoker after the age of 65, you are more likely to develop dementia. So the progression of the disease. There's no normal progression. I'm saying degression. Progression of the disease. It can last anywhere from 2 to 20 years, and it just kind of depends on the type of dementia that you have. 8.5 years is the average length of a dementia patient, and it's usually a long and slow decline. Obviously, 8.5 years for any kind of disease is a long time to have that. And then it's usually broken into 3 stages. So early, middle, or moderate stage, and then the late or severe stage. And we'll talk about each of those stages. And then this picture here is the brain in each of those stages. So early, middle, and moderate or late. So the early stage, like I said, these plaques and tangles can begin to form up to 20 to 30 years before a dementia diagnosis. That doesn't necessarily mean you're in the early stage of dementia, but it can, begin forming way before there are signs of it. The biggest is short-term memory loss. You start to notice that in the early stage. You start having poor decision-making and judgment. And then you start to notice things with problems with driving, managing money, and making meals. And a lot of this is because you're having trouble with following directions and doing something with many steps involved. And then also people in the early stage start to lose their ability to learn new things or recall new things. They can't recall someone's name that you met last night, or asking, a few extra questions. The middle to moderate stage, this can last anywhere from 2 to 10 years and is the longest stage. Obviously 10 years in a middle stage can be a really long time. Of course, you're going to see more confusion, more memory loss, more disorientation, more of those things that we talked about in the beginning stages. They're just becoming more prevalent. Language and communication, a common word is word salad. They're just not remembering their words, and they're getting them mixed up with common objects and common words. You just don't know what they're talking about. Difficulty with personal cares. So this is like dressing and bathing. They are having trouble with going to the bathroom. And then wandering. You may see wandering in the middle stages. And then the late or severe stage. This can start or last up to 5 years. It's usually the shortest stage. A person has limited verbal communication. They're very close to nonverbal. They're going to need 24-hour supervision because they're going to need help with things like dressing and making meals, going to the bathroom. They're going to start to have difficulty with chewing and swallowing, and they're going to have very limited physical activity. Usually they're not able to walk as much, get up and down out of a chair. And this is why someone with dementia, they die from it, because they are no longer able to swallow, to ingest food. Maybe they are starting to get fluid in their lungs, and the body can't get it out like a normal person. So with the progression of this disease, it's different for everyone. Everyone's experience is going to be different. It's difficult to predict what's going to happen because each stage is so different. Each person is so different. 2 to 20 years, that's a huge span. That's someone can have dementia. So someone with having it for 2 or 3 years is definitely different than someone who has it for 15 or 20 years. Of course, if your loved one has a diagnosis of dementia, have a plan not only for them, but for the caregiver. So know what their wishes are. Do they want to try to age at home and have somebody in the family take care of them? Or is it more practical for them to go into a dementia facility? But also with the caregiver, as the stages progress, is the caregiver going to be able to stay at home when in those later stages, or will you have to hire in care, or like I said, go into a facility? And different safety precautions are going to need to be made with each stage of the progression. So, in the beginning stages, someone may still be able to drive, but of course in the late stages, it's not a very good idea to let your loved one still drive. Driving is definitely the hardest thing that most people need to give up, and the reason behind that is because they're losing a huge part of their independence. All of us rely on our cars so much to get around every single day. It's a huge part of our life. So some warning signs of if someone needs to maybe rethink their driving. One, if someone gets a diagnosis of dementia, most of the time their doctor is going to immediately say you need to go take a driving test. But if they're starting to get confused on where they are, their lefts from their rights, getting lost in their neighborhood, or going to a familiar store, that's definitely a warning sign of maybe it's time to reevaluate the driving. Maybe you just need to limit driving at first, so they are just going less than 2 miles away to a familiar place, a place they've always been during the daytime. No driving during bad weather, or maybe someone else always has to be in the car with them. And some tips to avoid driving: make it convenient for them, bring all the services to them, have their medications and their groceries delivered, maybe have their hairdresser come and do their hair at home. Or maybe you just sell the car, and so they have no other choice but to take public transportation, or to always get a ride from someone, hire a transportation service. Just make it easy for them not to drive anymore. Wandering is a huge safety concern. Over half of all people with dementia will wander. And a lot of the times they're looking for something familiar, or they are going through an old routine of theirs. So they're taking their kids to school, or going to pick their kids up from school. They're going to drive to work, or walk to work, walk to the bus stop. They're looking for something familiar that they're remembering from their past, and that's what a lot of wandering is. Or maybe they're just leaving a room because it's really overwhelming to them. So people with dementia get really overwhelmed with a lot of sounds, or a lot of things going on, or maybe even if a wall has a lot of patterns on it, or a carpet has a lot of patterns on it, they're trying to get away from that. And then of course with medications, if someone's still able to take their own medication and manage it, be sure to keep it always labeled and clearly sorted out. But if someone is not able to take their own medication anymore, keep it locked up in a way so that they cannot get to it. There's lock boxes that you could just buy on Amazon with little codes on them, so that you can always be dispensing the medication. So in the home, always try to have good lighting. And like I said, people get really confused about patterns and things on rugs. The room I'm in has a carpet that has many different colors on it. That'd be really confusing. Maybe someone would think those are holes in the floor, and they're trying to avoid the holes, so then they're going to fall. With all older people that are starting to have balance issues, throw rugs are never a good idea. Try to avoid the throw rugs, even if it is covering a stain on the carpet or in an entryway. And falls become a huge safety concern. Before someone's dementia progresses too much, it's always a good idea to invest in a personal help button, so that they can either press it if they have a fall or some kind of medical emergency, but a lot of them now can automatically detect any falls. So, with the progression of the dementia, they wouldn't even need to remember how to press that button. So caring for someone with dementia, tips for the caregiver, being a successful caregiver. Remember to be flexible. A day may not go exactly how you think it's going to go. You may have to change the course of your day. Be present, be there for the person, be just someone to talk to. Again, just, being there for when their course of their day is changing. Remember to see the person and not the dementia. The person with dementia is probably feeling really frustrated, but they're still the same person that they always were. And you may have to adapt to a new normal. Your new normal may be that person with dementia and the changes that you may need to make for them. So if you are looking for some kind of support in your home or for that person with dementia, there are many places here in San Diego that offer respite care, and this can be either through an in-home care, or places like Alzheimer's San Diego do offer volunteers to come in and help with just giving the caregiver a break. So you can go and run to the store. If it's an in-home care, you can still go to work. In-home care will come in and do things like housekeeping, help with the personal care, the toileting, the bathing, the dressing, making meals. Maybe you start with just a few hours a week and you can always build up from there. A lot of them can come into your home for 24 hours a day, 7 days a week. And then, of course, adult day centers. This is an outside place that you would take your loved one and they would stay there for the day. A lot of adult day centers are geared towards people with dementia. They have activities, they have professionals on staff such as social workers, nurses, and then just professional caregivers to be there for your loved one and are very well trained in dementia. And then, of course, the holidays are coming up, and this can always be a struggle for those of us with older loved ones, and especially ones with dementia. And I always like to start out with, we set very high expectations for ourselves around the holidays, whether that's where our house is looking perfect with decorations, we have the best food prepared, we have the perfect outfit on, the best activities planned around it. We're going to go and look at Christmas lights and go ice skating and buy all the best gifts for our loved ones. But maybe we need to take a step back this year and lower our expectations. A really good idea, especially if things have really changed this year for you and your family, is to either set up a meeting or even just send an email out to your loved ones before to say, this is what you should expect, this is what has changed. If mom is no longer able to sit at the dinner table, or she may have to leave for an hour or two during the day to take a nap, let them know that this is what she needs to do and this is what they should expect. Or to not bring up things like, how's your car? Because she's going to then get all upset that she can't drive anymore. So just send an email out before, or make some phone calls, send some text messages. And remember, what are you doing for you versus your loved one? So maybe mom doesn't even want gifts this year. It's just enough for her to be around her family and have that wonderful meal and that time spent together. She doesn't need anything anymore. She's getting older. She has everything she needs. Or maybe instead of cooking that big meal, you're getting it catered in, or you're going out to eat. Just know, what do your loved ones expect of you? And maybe you need to change traditions. So maybe you have a lunch or a brunch instead of a dinner because mom can stay up more during the day, or it's just, easier during the daylight hours to do things. Maybe you're not going to look at those Christmas lights because that is really overwhelming to her with all of the motion and the different things to look at. Allow others to contribute. So maybe everyone brings a dish over to your house, or they're helping you with buying gifts this year. And this year, it's important to be the good enough caregiver. Everyone knows that you are trying your hardest, and with having the holidays on top of it, they know that you're really trying and doing your best. And of course, feeling guilty is normal in any caregiving situation, but know that everyone knows you are doing what you can. So some local services here in San Diego for people with dementia or Alzheimer's. Like I said, Alzheimer's San Diego is a huge one here. Right now they have a program going on with Medical Alert, and those are the bracelets or the necklaces you can buy for your loved one that says that they have dementia. So if someone were to find them through Alzheimer's San Diego, you can get one of those right now for free for your loved ones. So you can go on their website and find out more about that. Jewish Family Services, The San Diego Sheriff's Department has a program called Take Me Home where you can register your loved one, and if they were to be found out wandering, the Sheriff's Department would know that maybe that person has dementia, or they might be scared to talk to the police, and they can literally take them home, give you a call, and you can put your name and number to be associated, as well as a picture. Southern Caregiver Resource Center. And then right now UCSD is doing an Alzheimer's caregiver study. So if you would be interested in participating in that, you can contact UCSD about that. And then nationally, if you haven't heard of Teepa Snow, she's a great advocate and educator for people with dementia and Alzheimer's. You can look up her videos on YouTube. She is just so amazing. It's not like this boring education seminar that you're going to be watching. She has some really great tips out there for people with dementia. The Alzheimer's Association is a national organization, and then your local area agency on aging, if you are not here in San Diego, those are located throughout the entire country. If you Google area agency on aging and then your county, you will find your local one. So of course, join us next month for our next webinar in the Employed Family Caregiver webinar series. Does anyone have any questions? You can chat them here. So I'll stay on here for a minute. If anyone has any questions, feel free to ask them. Here, if you don't feel comfortable asking them right now, here's my personal email as well as ElderHelp's phone number and our information email. And we have, my doctor diagnosed my grandma with dementia but didn't specify what type. What should I do? That is a great question. So I would go back to your doctor. It also could be going to like a neurologist and asking more questions. You know, I personally can't tell you what kind of dementia they have, but also just do some Google searches on different types of dementia, and you may be able to kind of figure it out with some of the symptoms you're seeing in your grandma. But definitely go back to your doctor and ask some more questions there. We circulate the deck to those who attended. Yes, so this will be posted on YouTube, and I will send you out the link once that's put up. A geriatrician is a great person to go to, other than your primary care doctor, a neurologist as well. And yes, I will be putting this up on YouTube and sending out the link once that is up. Some resources for emergency response buttons. The biggest one in the country is called Lifeline, Philips Lifeline. That's the one that I personally would recommend the most and I have the most experience with. There's also Great Call here in San Diego. Again, if you just Google personal emergency response buttons, they will come up. It's kind of up to you on which one is going to work best for your family. If someone has dementia, I would definitely recommend that auto alert button that can automatically detect a fall. But some good things to look at if you're buying a button is it waterproof? Because most falls are going to happen in the bathroom and the shower. Does it need to be recharged? And can it automatically detect the fall? And does it automatically call 911, or can it call a first emergency contact before 911? A list of adult day centers. Edna, if you want to email me, I can send you out some of those privately. Any other questions, guys? All right, well, like I said, if you have any other questions, please feel free to email me or give us a call. And thank you so much for joining. I'll send out the link in hopefully the next day or so.